Health, Home, and Lifestyle. Presented by Paradise Fitness Center, changing lives since 1996.
Hi today and welcome to the Health, Home, and Lifestyle edition of KUAM News Extra. I'm Isa Baza, so glad you could join us. Coming up in tonight's show, we tell you about the new mobile care clinic, which will be providing free community health care services to the community. But first, here's this week's Health Check Report with Joan Uggan-Charfris.
Health Check is presented by Island Cancer Center.
Dr. Nathaniel Berg of Guam Radiology Consultants will be opening the Guam Vein Institute in early August to coincide with a visit by renowned Orange County vein specialist Dr. Bruce Hoyle. Dr. Berg has been treating arterial disease locally for about 20 years.
We often ran into obstacles. We'd finish treating the arteries and then find that there were still swelling. The patients still had pain, and they had ropey veins, and they had ulcers, that's open sores that weren't healing. We knew these were from the veins, but there wasn't a whole lot we can do.
So a group of physicians at Guam Radiology decided something needed to be done. The first thing was to get educated, and second was to seek out expert advice on how they should start their approach in treating vein disease here in Guam. Dr. Hoyle operates a private practice in Southern California which specializes in treating venous diseases.
Untreated venous disease can lead to blood clots in these veins, these varicose veins. It can lead to hemorrhage. Sometimes these veins are sticking out a lot. Women are shaving their legs, they nick them in the shower and it starts bleeding. They can erode through the skin. They can cause what we call a venous leg ulcer. An ulcer is a wound. There are many kinds of ulcers, but the majority of leg ulcers are venous or vein related.
The Guam Vein Institute will focus on the treatment of varicose veins, spider veins, facial veins, and hand veins, which can cause aching, pain, and discomfort.
Our particular situation here on Guam, where we know that things like smoking and diabetes may not cause varicose veins, but it complicates the treatment because the patients already have less blood flow to their legs, so it becomes harder to heal ulcers and skin infections. And also we have a large obesity burden, which also contributes to making it difficult to treat the varicose veins, and diabetes being out of control at times, meaning both we have too much in the population, but also the lack of well-controlled diabetes can make it more difficult for us to treat the venous disease.
Sometimes varicose veins lead to more serious problems. Varicose veins may also signal a higher risk of other circulatory problems. Dr. Berg notes that a large number of patients locally have had vein-related diseases for many years, some going on decades, and that many require specific expertise to get effective treatment. According to Dr. Hoyle, in the last decade, the technology has changed radically, and vein-related disease is a field which has changed dramatically.
With new innovations such as lasers and new drugs, new surgical techniques, we can treat virtually all of these kinds of problems in an office setting. Some of these patients will have deeper venous disease. Well, this clinic is already well equipped to handle that kind of situation. The superficial kind, though, has again significantly changed. This can all be done in the office. They're not put to sleep. They drive home. They can even go back to work the next day.
However, according to Dr. Hoyle, because some of the medical population overall is poorly educated on how easy it is to treat these vein-related diseases, so often patients are given improper treatment and/or advice.
I'm hoping to help Dr. Berg educate the medical community that it's a different time now, and it is a significant burden of illness in this population, as it is in the United States. But even there, I'm constantly trying to go out and speak to doctors and educate them that this is a new world.
For more information, you can go online and check out www.guamveins.com. With this week's Health Check Report, I'm Joan Uggan-Charfris.
Health Check is presented by Island Cancer Center.
Thanks, Joan. We'll stay tuned. We'll have more on the new mobile care clinic after the break.